my name is Jessica Lackey. I'm a CN3 on the HBC unit. I'm going to be talking to you about back priming and secondary tubing. What we're going to cover in this video will be compatible secondaries, incompatible secondaries, and hazardous meds. It is best practice to check IV compatibility prior to hanging medication. Waste any remaining medication from chamber back into the old IV piggyback bag. As you can see, the chamber cannot completely empty. Fill secondary chamber completely with primary fluid, then waste in the old IV piggyback bag. Make sure to repeat for a total of 2 times. As you can see by the light green tint to the fluid, there may be residual medication. Only reuse secondary tubing if IV piggyback medications are compatible. Remember to always check compatibility prior to administering medications. Once that is complete, you will discard old IV piggyback and attach new IV piggyback onto the same secondary tubing. If you have to hang incompatible meds on your primary tubing, make sure to back prime into old secondary tubing until the chamber is completely filled with primary fluid. That clears the hub. Then you're going to want to disconnect the secondary tubing and attach a Curos to it. It should be labeled with date and time of when the tubing was first opened and used. Once disconnecting that tubing, it is only good for 24 hours. Make sure to add a label that says trash with the date and time, which is 24 hours from when you disconnected it. You will then scrub the hub per policy and attach your new secondary tubing. Next, we will discuss back priming secondary tubing and hazardous medications. Do not disconnect hazardous med IV piggybacks from secondary tubing. The goal is to clear any hazardous meds left in the primarily lined port and the chemo locks. What you will want to do is waste any remaining medication in the chamber back into the piggyback. Then you will back prime primary fluid to fill the secondary tubing chamber completely. Once complete, you will clamp your secondary and you will want to disconnect between the chemo locks. You may reuse the chemo lock patient port for the next hazardous med. When hanging a secondary tubing that is not hazardous, you will want to follow the previous steps for back priming and clearing the possible residual haz med in the chemo lock ports. You will then disconnect between the chemo locks. Next, you will disconnect the chemo lock patient port from the primary tubing. Be sure to maintain hazardous med precautions. Once done, you will scrub the hub per policy and attach your new non-hazardous medication, secondary tubing, and IV piggyback med.